This video is about management of patient with dyspnea in emergency room. It is a real case that we had in our hospital. Hope you find this video helpful and useful in your medical practice and use it for management of your patient. He was a 65 years old man with acute onset dyspnea from 1 hour before admitting to hospital. Firstly, in primary survey, patient was alert, oxygen saturation of 65% and heart rate was about 120. Blood pressure was 12/8 and respiratory rate was about 35. Patient had history of smoking from 30 years ago, and also in physical examination we detected rouse and lung sound, and also bilateral lower limbs edema was detected. Based on physical examination and also history of the patient including smoking and also lower limbs edema, the patient may have COPD exacerbation or he had a heart failure and acute pulmonary edema, but it is really difficult to distinguish these types of diseases in emergency situation. So sometimes we had to manage both of them. We should start some medicines for the heart failure management, and also some medicine for COPD exacerbation. In this case, both of them were considered, but with more focusing on heart failure based on lung ultrasound and lung sounds, and also cardiac ultrasound results. In the rest of the video we try to show you how this patient was managed, and also we will show you lung ultrasound features and the cardiac echocardiogram of him, and finally you will find him in a stable condition without respiratory distress just after 1 hour from admission. For watching other cases, interesting topics in emergency room, please don't forget to subscribe our channel.